Hello everybody. First I would like to thank the organizers to have invited me to this neuroscience symposium to be part of it because it's dedicated to epilepsy, and also to say that I'm very happy to be part also of the development of Armenian epilepsy surgery program, a big part of which are also children with resistant epilepsy, and I hope we could help a lot of patients and our colleagues, dear colleagues in Armenia. I don't have anything to disclose it as conflict of interest, but just to mention that my interest is in some of the older seizure classification, despite we are using more and more the new one. And we can compare the citation, but still I like very much what has been done by Hans Luders and many other colleagues, because not only because many of them are my teachers and mentors, but also because it is very important to really have a good classification system of the seizures, and especially in the childhood age. So in some part of my talk, I will also use some of these terms created and included in this classification system by Hans Luders and some of the founders of the contemporary epilepsy surgery. What about children and childhood? We know that there are at least 4 stages according to developmental psychology. All these 4 stages, they show the fastest developing of the human being, not only but especially of its brain. So we can suppose, and many of us know, that childhood seizures are also developing, so they are changing during all these 4 stages of the childhood development. This is one of the main papers I found about semiology of epileptic seizures in childhood. This is about the first year of life. This paper and study appeared at the end of previous century. Is done by the Cleveland Clinic, and they found that a significant amount of the seizure types in childhood are presented by epileptic spasms. Clonic and hypomotor seizures are on the 2nd place, and tonic seizures are on the 4th place. So these are the predominant motor features we found in epilepsy seizures in childhood. So they account for more than 80% of all seizure types. So conclusion of the authors was that repertoire of the seizures in this age period in infancy and childhood is quite limited. So also that epileptic spasms may be focal as well as generalized, and video EEG monitoring and neuroimaging, so especially modern neuroimaging and MRI is crucial for clarifying the nature of the seizures. This was found also by another study published 2006 by 2 other experts, Doug Nordley and Christian Korf. So they described 30 seizure type in close to 70 patients in the age range of 1 to 23 months. And they also found that majority of the seizures were presented by spasm, focal clonic and focal tonic seizures, and also what they called behavior arrest with version. So more than 2/3 of the children presented these seizure types. Again, they emphasize that video EEG and accurate seizure classification extremely important, because they give us this fundamental information which is helpful to establish the correct epilepsy syndrome diagnosis, but also to find the correct treatment option, including epilepsy surgery. The rarest type in this study is generalized tonic-clonic, this pure behavior arrest without focal sign of version, but also hypermotor seizure, which was quite unusual. So these are the rarest seizure types. And they also found that this classic generalized tonic-clonic seizure was not observed. The generalized seizure appeared quite later in comparison to focal seizures, and spasms were included because they were probably the most common seizure type with the median age of 8 to 8.5 months, and even they can be the predominant one in this age, especially if they are combined with focal seizures. So very early they found that the so-called diffuse tonic to focal clonic seizure can appear from birth to the age of 14 months, and also focal clonic seizures and this particular type of behavioral arrest with version. A bit later, they found that generalized tonic, atonic, and clonic seizure can appear still at the age up to 1 year. Also interesting that found that infantile seizures are short, both in clinical and electroencephalographic term, from close to half a minute to less than 1 minute in terms of EEG, and also that we cannot rely solely on the clinical observation to predict what would be the electrographic correlate of a seizure. So video EEG extremely useful and even necessary to be performed in order to clarify the nature and localization of the seizures. And this is one of the main studies done by Andras Fogarash and the team in one of the oldest epilepsy surgery center in Europe, in Bielefeld in 2001, so more than 20 years ago. They focused on the main seizure epilepsies in childhood, and first then they evaluated the frontal lobe epilepsy. They also confirmed that epileptic spasm and these subtle behavioral changes are very frequent, in contrast to hypermotor seizures and these complex motor automatic behaviors which are not seen. And also generalized tonic-clonic seizures were quite unusual. So frontal lobe epilepsy bears very prominent age-related features in children less than 7 years. This is the last study I found published this year in Annals Child Neurology. Of course, they found different focal seizures in frontal lobe epilepsy, the focal tonic being the most frequent, followed by hypermotor and focal clonic, but also a lot of patients, so 21 out of 56 patients in the age of 1 month to 14 years, they reported some aura. Interestingly, that focal tonic, not unexpected, they were related to a premotor epileptic zone on the scalp EEG. Prefrontal epileptic zone were found to correspond mostly to hypermotor seizures, which were also related to premotor one, but also, as you see, focal clonic seizures, which we usually correlate to a central epileptic zone or premotor one or mesial frontal, they actually much more often correspond to a generalized EEG, which is also true for the other seizure types like the focal tonic. So EEG and seizure semiology in this group, even in the bigger one from 1 to 14 years, it's not easy to correlate based only on the seizure semiology. As to the aura, it was found in 21 seizures, and interestingly, it was not only somatosensory which was present in 9 of the children, but also could be psychic of nature, which we usually relate to a temporal lobe epileptic zone. So if present, aura is very important, but actually it could be evaluated in order to understand the characteristic of frontal lobe seizures, because also many of the children, they do have negative MRI, it is close to 70%, and EEG, even in focal seizures, could be normal indirectly, like here in the study in close to 1/4 of the seizures. The team of Bielefeld and Andras especially evaluated also the other types of extratemporal epilepsy, and found, not surprisingly, that tonic seizure and clonic seizures were more frequent in frontal lobe epilepsy, in contrast to posterior cortical epilepsy, when they found this well-known sign of post-ictal nose wiping, which was not true for myoclonic components, for spasms as peculiar seizure types in childhood, for so-called psychomotor seizure, atonic seizure, and different types of automatism, as well as for vocalization and eye deviation, because they could be observed in posterior cortex, but also in frontal lobe epilepsy. Of course, it's very useful to know the appearance of the seizures and also the type of the aura, because, of course, visual aura is very specific. It's characteristic for posterior cortex epilepsy, And nocturnal appearance is more often and usual found also in children in frontal lobe epilepsy. Posterior cortex epilepsy are quite frequent in children as well, but in younger children, this group also evaluated the seizures and found they are much more frequent than in adults, but usually of shorter duration. The children, of course, much rarely report aura, and this is, of course, important to ask in verbal children, but if not present, the ictal signs, very subtle, like smile, flush, a small head nod and some behavioral changes can be very frequent and also typical for the posterior cortex seizures in children. This is another study on posterior cortex epilepsy done by the group of Claudio Munari Center and with main author Alexandra Liava, but Stefano Francioni is one of the experts of posterior cortex epilepsy, also in children. Majority of these children they studied presented with complex partial seizure or such with focal unaware seizures according to the recent classification. In more than quarter of this group, they found also that spasm predominated, and usually the onset was quite early, even before 1 year of age. As you see, secondary generalized seizures were not so often seen, and as found also by Bielefeld group, the frequency of the seizures were quite high, so majority of them presented daily seizures and multiple, and even 7 out of the 62 cases presented with status epilepticus. As to the prevalent ictal semiology in pediatric age group, of course, to mention again that subjective visual symptoms are very important, but if they cannot be reported by children, we have to seek for oculomotor signs, which are important, and the eye deviation especially, which could be contralateral in majority of cases, regardless tonic or clonic, but even monoocular. In some of the cases, like 9 of the tonic deviation case, it could be also ipsilateral. The evolution is various. Sometimes it follows the frontal lobe pattern, so-called with axial deviation of the head, and then with hemiclonic or adversive seizures. And this was found in 1/3 of the cases, usually in children which have who have a pure parietal lobe localization of the focus, whereas temporal lobe pattern with autonomic vegetative sign and some automata, usually oroalimentary, they are much more often seen in pure occipital lobe localization. So this is the ventral stem, and the other one is the parieto-frontal stream of the spreading of the seizures. The visual aura is the most frequent, of course, was present, however, in 22 out of these 56 cases. And interestingly, in a lot of the cases, they found that fear is quite prominent side, so close to 20% of the cases they presented fear, which is also, to say, not only a temporal sign in these patients, because the temporal hour was regarded as abdominal or psychic, similar to adults. Another study done by a group in Cleveland found that, as in adults, auras and automatism prevailed in temporal lobe seizures, but hypomotor, as already mentioned, is quite typical semiology for frontal lobe seizures, and usually hypermotor semiology is more characteristic for multilobar or temporal lobe seizures. And the other seizure types like tonic, clonic, or combined tonic-clonic seizures, as well as tonic, myoclonic, and spas, they have usually or exclusively generalized EEG and were generalized in their nature. Automatism in temporal lobe, similar to adults, were manual and oral, and the proximal automatism are much more often in frontal lobe epilepsy. However, as you see, hyperkinetic, which is hypermotor seizures, usually were primary multilobar, but could be even also frequently found in frontal lobe epilepsy or temporal lobe epilepsy, And in these patients, they were a bit more common, often seen in temporal lobe epilepsy, so 25 in comparison to 22 children. And coming to the most common epilepsy in adult, which is also important in children, this is temporal lobe seizures. Again, Bethel team and Andras evaluated this type of epilepsy and found that the motor features were very marked and quite early, quite prominent in children, and they consisted of tonic and myoclonic components, as well as already mentioned, of epileptic spasms. Of course, which is interesting and also confirmed, but the other authors earlier and later, the frequency of these motor components decreased with age. So the conclusions of this study is that probably events in brain maturation significantly affect the semiology of the seizures, so they may override the more typical localizing features we know quite well from adult type temporal lobe epilepsy. And these are two cases which confirm this age-specific etiology, because of this smaller child, the younger one, Valerie, with a Leah on the right temporal. The semiology is quite different from the older child who is already almost 2 years old, with the same etiology on the same side. So in this child, the spasm prevailed and quite symmetric. And in the older child, we can see this tonic posturing, the orientation to the left, and the immobilization of the left extremities. So seizure semiology is age-specific, and spasms are really occurring in younger children. About the evolution of this seizure semiology, it's a very nice overview by Prakash Kotagal and colleague. So again, they come from that infants and small children up to 3 years. They have a very prominent motor manifestation like tonic, myoclonic. They can be bilateral, symmetric, as we saw. And in older children, especially in school age, this motor phenomena are less more prominent, and they they change to this contralateral dystonic posturing, which is already quite common. And auras is quite rare or difficult to recognize in small children. It's common, and especially the abdominal type, which is temporal lobe specific, which is seen mostly in older children. As to automatism, they are quite common in all ages, but still they become more complex with age, and hand automatisms add to oral elementary, which can be present also in infants and babies. So this is another nice study done, published last year and done by the group in Rothschild in France. So they studied semiology of temporal lobe seizures in preschool children in close to 30 patients. Many of them are explored by invasive electrodes, temporal depth electrodes, but also foramen ovale and sphenoidal electrodes. And they found that majority of the children who have specific ictal semiology similar to adults, they belong to this group of mesiotemporal lobe epilepsy, a bit more than half of these children. And it was not true for the other localization of temporal lobe epilepsy like polar or mesiolateral or clear lateral, especially for the lateral epilepsy. None of the children reported the classic including auditory hours, of which we know from adults. Quite a lot of these children had also infantile spasm, more than 10%, and in 1/3 of them, close to 1/3, they have clear lateralization stunt. So the conclusion is that again, seizures were non-specific. Quite often they have been like subtle events or infantile spasm, but interestingly, many of the seizures which were due by Liat in mesiotemporal lobe epilepsy were characterized by apnea, so this is quite specific for this type of epilepsy. And because I mentioned many times, and it was out in this study, that epileptic spasm are very typical for children in all ages, but especially in younger one, in babies, and the early onset epilepsy. This is a study done again by Dr. Nordlian Burke and a Korean colleague. They evaluated 3 groups of EEG findings correlating to spasm, hypsarrhythmia, and no hip syringe, so normal background, and 2 age group less than 1 year and above the age of 1 year. So there were no differences in underlying causes in their location or extent of the MRI lesion, if present, but also the ictal patterns of the spasm are remarkably similar. So they concluded that the spasms present, epileptic spasm present age-dependent epileptic manifestation, and actually they do not present different syndromes. And this is also can be confirmed by these two cases. In first case, this is a genetic syndrome, severe one, and this is actually a unilateral encephaloplastic lesion. So of course there are semiological difference because in this child there were no prominent. There is asymmetry because of the ravis on the right, but still this is spasm prevailing, so they can be seen in focal as well as in generalized epilepsy and invariant etiology of the disorder. So there are subtle differences below the age of 1 year. Affection, so involvement of the arms and legs was much more common than in older children. And with age, involvement and flexion of the head and not so much of the trunk was much more prominent than in younger children. And this difference, which were not so significant. Actually, the authors concluded that semiology of the spasm, presence and preceding of concurrent seizures, some periodicity of the spasm. This is subtle variability between these two age groups. They were not clinically very dramatic, except probably this unresponsiveness and behavioral arrest, which was more common in group of children less than 1 year and not so common in older children. It was especially characteristic for crying, which was more common in babies in comparison to older children in the group after the age of 1. Such seizure type, the spasms and also myoclonic seizures were also quite typical for the probably rarest type of epilepsy in childhood, the insular or insulo-opercular epilepsy. Also in this type of epilepsy, quite specific spasm and myoclonic seizures prevail initially. Then neurovegetative sign can be seen, but also asymmetric tonic and hypermotor seizures. And autonomic symptoms are very peculiar, and they need to be seen because like strange reaction, arrest or suffering, or flush, cyanosis, apnea, and change in cardiac rhythm are very important because of impossibility of the children to describe their semiology, which is quite important because of early onset of children. Not all of them can be verbal and can describe what they feel, but still in this age, again, insular seizure onset must be suspected mostly in children who present with semiology of frontal lobe epilepsy. In older children, this is the hypermotor seizure and also the tonic seizure. This is a very nice study done again by collaborators of Hans Ludes and Guadalupe Fernandez. It was published 2018 and it even award by Epileptic Disorder Journal. They studied more than 250 patients in all age groups. As you see, there is a peak after the age of 10, but still one peak in the very early childhood age. So they found that focal epilepsy was usually more frequent in patients after the age of 10 years. And there is a gradient in the epileptic zone in children, because the most frequent in epileptic zone in patients from 1 month to 3 years is the undetermined, then the posterior one prevailed up to the age of 3 years. Between 3 and 6 years, so it's the school age, the temporal preschool age, temporal epileptic zone prevailed, and in frontal epileptic zone, so the anterior one is in the school age from 6 to 10. After that age, usually the most frequent one, epileptic zone, was of temporal lobe origin. And these are several graphs demonstrating the most frequent seizure and seizure component. These are patient age 1 month to 3 years. As we already saw, these are generalized epileptic spasm, myoclonic and hypomotor seizure prevailing, usually of undetermined or generalized EEG. In the next age group, 3 to 6 years, these are the generalized myoclonic seizures, again of generalized EEG, focal tonic and generalized tonic or clonic seizures, which more focal epileptic zone, or but still it could be undetermined. And in the age of 6 to 10 years, dialectic seizures similar to psychomotor or temporal lobe seizures, but also focal tonic and clonic are seen, and already in this age they could be a focal EEG, but also with generalized, and these are corresponding probably, not probably, but also to absences. In older children, so in adolescents, the picture is very much resembling to adults. Focal tonic or clonic seizures versus and generalized tonic clonics, already with well-known, well-seen focal epileptic zone, or in some cases undetermined. And interesting, they found that the youngest patient which was able to report an aura was at the age of 6 years. Classical automotor seizure was observed in a child of 3.5 years. And usually this patient less than 3 years have generalized but simple motor seizures and hypomotor, already many times mentioned, and these are the seizures of generalized nature, spasms, tonic or clonic seizures, which were found to be quite rare after the age of 10. So seizure semiology in EEG for sure reflects the maturation of the cortical function. And I would like to conclude also, because there is an Armenian name here collaborating with Hans Luders with this main finding and overview of seizure semiology and its value in all ages, not only in children. We have to remember and not to forget that seizure semiology is the manifestation of symptomatogenic zone, its activation. So it could start elsewhere in the brain, in the epileptogenic zone, but then the symptomatology comes from the symptomatogenic zone. So it's not covering or not correlating to the epileptogenic region. Not infrequently, we can see in a seizure conflicting, controversial lateralizing or localizing. So every seizure and every sign is important because we have to study its sequence, and also the importance of each sign is determined based on its specificity and the appearance during the sequence of a seizure. And also seizure semiology is becoming more complex with the age. And also, as we saw, not only because of the example of epileptic spasm, generalized motor seizure can be related to a focal epilepsy. Very important, there are some seizure types like focal, clonic, and tonic, as in adults, also in children, then they always lateralize to the contralateral side. And especially in infants, some very focal side like sustained diversion. But when this is alone, this is not a reliable lateralizing sign. So again, to emphasize, and we know it quite well, and use it every day in epileptology, video EEG is the only tool to properly observe, evaluate, understand, describe, and correlate any seizure in any age, especially in children. Thank you very much for your attention. And I'm ready to take questions, if any.